Hi, my name is David Lose, and I'm going to be a senior at Lake Catholic High School this coming year. And I'm a member of the Science Internship Program, and my project will be on decreasing incidence of non-therapeutic INRs in the hospitalized setting by increasing nursing knowledge base. Now, a little background on the drug that we work with at the anticoagulation clinic is warfarin, and it was first synthesized at Wisconsin in 1948, and the name was derived from the Wisconsin Alumni Research Foundation, and it was first approved by the FDA in 1954, and the reason for the 6-year difference was actually because the drug was founded before the FDA was even existed. And the pharmacokinetics, the peak concentration is within the first 4 hours. It's highly bound to proteins where it's metabolized, primarily by the CYP2C9 and other proteins minimally. And the half-life is 40 hours. It takes 24 to 72 hours to fully onset, and the duration is 2 to 5 days. Elderly patients have greater response to PK and PD factors, and there is a pregnancy risk for warfarin. The drug passes through the placental barrier, which may cause hemorrhage in the fetus, and there's no adjustment for renal dysfunction and increased response in hepatic dysfunction. Now, monitoring INRs. Your INR is the International Normalized Ratio, and it's the standard measurement for the viscosity of the blood. And this is the machine that we use in the anticoagulation clinic. It's called a CoaguCheck. And what it does is it measures the viscosity of the blood, the INR. And it's pretty much shaped like a diabetes reading machine. So there's that. And the INR is derived from the patient PT divided by the normal PT, which is the ISI, the International Sensitivity Index. And most patients in the Coumadin Clinic come there for many different reasons, and these are the main causes, and the INR is the range that we want them to have their blood in, their blood viscosity, and there are the normal ranges. The 2 to 3s is what you mostly want to keep the majority of the patients between, and then occasionally for prosthetic heart valves, there's the 2.5 to 3.5. The thinner the blood, the easier it is for these sorts of patients to pump the blood throughout their system. And the hypothesis behind the study was the purpose behind conducting it was to determine whether or not it was possible to reduce the incidence of non-therapeutic in the INRs by increasing nursing knowledge base. The study was done in an attempt to decipher why INRs are non-therapeutic in the inpatient population. And the importance of this research is to prevent non-therapeutic INRs, which in turn reduces the risk of complications while out of therapeutic target range. And these complications can be anywhere from stroke or blood clot if the INR is too low and the blood is too thick, or if the blood is too thin, it can cause hemorrhage or extended bleeding. Now, the methodology for this project was the data was collected, or the data was to be collected and analyzed for the study development. First, the survey to be used, the OAK test, was validated by a random sampling of experienced nurses. And because we did not have IRB approval, the rest of the steps for data collection were not able to be carried out. But had we had IRB approval, the survey would have been taken by the entire nursing staff at Euclid Hospital. And finally, the data will be collected and analyzed to show the knowledge base of nurses in the hospital. And from here, conclusions will be drawn on what further actions to take. A literature review was done on several studies as a precursor to the study, and nursing knowledge is key to therapeutic inpatient INRs. Patient and family education is an important aspect of warfarin therapy for therapeutic results to continue, and patient education on warfarin must be delivered at approximately a 5th grade level. Now, this is key because a recent stress has been put on health literacy, and there's many different sources that will tell you that health literacy needs to be delivered at 4th through 6th grade. No one has really set a clear level, but it's important that 4th through 6th grade is the literacy of the majority of the population, and that health terms and terminology needs to be communicated to patients at that level. And here is the literature review that was conducted. And the only results we had were from the OAK test validity, and it showed that according to our surveyed nursing staff, the OAK test proved to be relevant, clear, and important. And normally the OAK test, which stands for Oral Anticoagulation Knowledge Test, is used to test patient knowledge, but our surveyed nursing staff found it to be a suitable test to assess the entire nursing staff. And each question scored at least an 80% in relevance, clarity, and importance, with 18 out of the 22 questions scoring a 90% or above in each category. And here's the complete chart for each of the 22 questions. And the recommendations that we have from the study is the random chart review was done as preparation for this study has revealed a need for standardized means of accurately tracking any inpatient on warfarin therapy, and increasing nursing knowledge of warfarin therapy through education, for example, in services delivered by the anticoagulation staff, increasing nursing awareness of patient health literacy, and as I said earlier, that 4th through 6th grade range is where health literacy should be delivered, and patients need to understand their warfarin treatment to fully get the maximum benefit. And as a big thank you, I would like to mention all the gratitude I have for the following people. Shelly Mason for being a great mentor, Patrick Finnegan for being an excellent peer mentor, Cheryl and Terry for always helping me out in the clinic, Ms. Nedra Starling for always answering my questions and for giving me the great opportunity this summer, along with the Cleveland Clinic Office of Initiatives, and for all other people that helped make this summer internship easier and more enjoyable for me. Thank you very much.